Chris Myths. So am I anti-chemo? Well, the answer is no. So I've seen online people claiming that I am anti-chemo. Now, I made a decision in January 2004 to forego chemotherapy. So I said no to chemotherapy for stage 3 colon cancer. And I used nutrition and natural therapies to support my body and help my body heal. And that's the reason I believe I'm alive today. Choosing a conventional treatment of any sort is an individual decision. And me telling someone do chemo or don't do chemo is actually medical advice, so I don't do that. But because I've been critical of the cancer industry and I talk about the risks of chemotherapy, people assume that I'm anti-chemo. Now, I have several chapters in my book devoted to the cancer industry and the medical industry to show you the things you need to understand so that you can make an informed decision before you say yes to treatment, because it depends on the type of cancer you have. It depends on the stage of cancer you have, whether or not chemotherapy can actually be helpful and beneficial to you. So in many cases, for late stage cancers, chemotherapy is not curative at all. It's only prescribed as palliative. But one survey found that almost 3/4 of late stage cancer patients who were undergoing chemo thought it was curative because their doctor didn't tell them it was only palliative. And that's one of the things that you really need to understand before you say yes to treatment is this drug treatment likely to cure me, or is it just to buy me more time? I also created a free guide called 20 Questions for Your Oncologist, which you can download at chrisbeatcancer.com. That gives you a ton of questions to ask so you can make an informed decision. Having said that, there are some cancers that respond very well to chemotherapy. Childhood leukemia, testicular cancer, and lymphomas have up to 90% 10-year survival rates. Now, on the flip side, most solid tumor cancers like breast, liver, lung, colon, ovarian, cervical, brain cancer, those type of cancers don't respond as well. In some cases, chemo can work really well and be curative. In other cases, not so much. So again, everyone needs to make their own choice, but be informed, ask the right questions, and find out if the treatment you're about to say yes to really has a high percentage of curing you versus just buying you more time. So to sum it up, I'm not anti-chemo. I'm not anti-anything. I'm pro anything that supports health and healing.